Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Abdominal muscles and their nerve supplies. So first we are going to look at the EOM, that is the external oblique muscle, or we can write it as EO, external oblique, and the RA. RA stands for the rectus abdominis. So what is the nerve supply here? The nerve supply is nothing but the T7 to 11. So it is a T7 to the T11, and they are nothing but the intercostal nerves. So it is nothing but the intercostal nerves along with the subcostal. So it is a T7 to T11. Next what we have is the IO, that is the internal oblique, and the TA, that is a transverse abdominis. So in the internal oblique and the transverse abdominis, it is again the T7 to the 11, T7 to 11 intercostal nerves, and it includes the subcostal nerve and the L1. So there is subcostal nerve as well as the L1. Then we move on to the pyramidalis. So in terms of pyramidalis, the nerve supply will be, there is subcostal nerve. In the subcostal nerve, it includes the anterior division of the T12. It is the anterior division of the T12. Next is the cremasteric. In the cremasteric, there is the efferent for the cremasteric reflex. In cremasteric, there is efferent for the cremasteric reflex. So the nerve supply here is going to be the genital branch of the genitofemoral nerve. To learn and grow daily like this, please do subscribe.